2022, we have seen patients here to the numbers of 3,962. In 2023, we saw outpatient on mental health cases of 3,260. In 2024, this year, up to mid-year, we managed to see 2,050. The admissions. In 2022, we had 118 admissions in our mental health unit. In 2023, we had admissions of 81, and up to half of the year 2024, our admissions had reached 51. About alcohol and substance abuse, in 2022 we had 17 such cases, 2023 we had 18, and 2024 up to midway 16, a total of 51. That is people suffering from alcohol and staff abuse. A lot of youths are within that number, and even professionals, including but not limited to everyone. Even teachers, even healthcare workers are there, even civil servants, anybody. Mental health does not discriminate. We have established satellites clinics in the 6 sub-county hospitals that we also visit. We have an expanded mentorship programs for doctors, clinical officers, nurses, psychologists, students. Up to 70 of them per year come from the various MTCs and universities in Kenya. They come for attachment here in our inpatient mental unit. Ladies and gentlemen, our theme today, as the chief guest said, is it's time to prioritize mental health in the workplace. That is the theme for 2024. Two major challenges that we have. One, we still have few staffs, but even the ones we have really managed to do within and even go outreaches. The other one is stigma. People stigmatize mental health. So we want to call upon everybody not to stigmatize mental health. Allow me to recognize the people seated here, 9 of them. Can you wave to all of us? Our good brothers and sisters, thank you. You can see they are very calm, still. So if you get your brother or sister is out in the community and causing havoc, bring them here. So,
mental health is actually treatable. Mental health is a condition like any other health condition, and that together we can overcome it. I want to speak on behalf of the county government and say we are committing to put in more resources in there. I will do my part to ensure that you don't have to run far. As I speak here, as I stand, I have 3 young family members, my nephews, who need mental care. As we speak, I'm planning to go to Asumbi to find help. Dr. Hero, I will sit down with you to help me with if I have to go to Asumbi or we can manage them there here in Siaya. But that's the challenge many of us in the families are going through. Young people are facing a lot of challenges. They're going through depression for different reasons. Our environment has become difficult for young people and they don't know how to manage. And if you are left on their own, they are not checked. There are so many cases in the villages. Young people who have got into drugs, and the moment they wake up in the morning, the first thing they want is changa.
By name, I'm Dr. Bernard Onguche. Currently, I work with the Department of Health, a project called Ngima for Sure. I'm here on my own capacity, but also on behalf of the CEC Member for Health. If you look at what we call non-communicable diseases in Kenya, mental health is the fourth one. Mental illness is the fourth non-communicable disease. It's not spoken about as much as it should, like others, like diabetes, hypertension, chronic kidney diseases are the others. But mental health is what we call a silent disease. So what we need to do is bring it to the forefront, bring it to be highlighted like we highlight a lot of other diseases. I'm happy that to some extent, probably to a greater extent, the county government of Siaya, through the county referral hospital, has set aside a unit for mental health. It's a start. Probably right now it's just stationed physically here within the county referral or in Siaya, just in town, with a psychiatrist, 2 psychologists, 8 mental health nurses, social workers, counselors, but also through the primary care networks, which I'm glad Dr. Ahero was the first one to actually utilize that, the PCN. Through primary health care networks, we also have these services being provided in the other sub-counties as well on a regular or rotational basis. We heard what the client said, and I know the NCD coordinator is here, Omoth. We need to look at our planning from the next cycle of budget. If it was not there, we need to have a way of including something within the renovation of the mental health unit. So we are also keen about that. We should not have our clients in those kinds of conditions that you highlighted. So we'll take it up, and in the next budget cycle, we will have something to do with renovation of the unit. We need to demystify and know that just like other illnesses, mental illness is also preventable, is manageable, is treatable. And someone can actually get well with early screening, early treatment and management. And someone can be rehabilitated fully and goes back to be a very productive member of the community. I want to applaud the clients that we have with us here who are helping to remove stigma for mental illness. We all need to make use of these services, counseling services from the facility and even other people that are offering that service, like their money and the Action for Mental Health Africa. They are here. Group therapy services, social events, even just meeting and playing and sharing, even that helps us to maintain our mental health. Even exercise, either in the morning or in the evening on a regular basis, even that supports mental health.
We can proceed because he's having a special meeting with the CDC, and the meeting is supposed to be starting from 2. So we had 2 people that were to give testimonies. Tell me those days. Now Dr. Tielo want to give you something for appreciation. That is very wonderful. So you are coming, nakupata to post. The person who danced with you is going to have another special meeting. Unaenda kufanya kapsea?
Yes.
What is your expectation?
I just want to get good grades.
Okondi kosoki kokontinyu. Owachi kosoki kowachi. Aya, koro kapoko wacho, madam. Hello. Aya, ukusema jina yako. Unaitwa nani?